Stop what you're doing right now, because what I'm about to show you could save your hip. Most people who end up on a surgical table could have avoided it, but they made silent mistakes that accelerated the destruction of the joint without even realizing it. I'm going to show you exactly what those mistakes are, and if you recognize any of them in your routine, pay close attention, because there's still time to reverse the damage. Ignoring this means continuing down the path that leads straight to surgery. And when you understand what you've been doing wrong, you'll see why everything you've tried so far hasn't worked. Let's begin. If you feel that hip discomfort that comes and goes, if you're afraid to make certain movements because you know it will hurt later, if the thought has already crossed your mind that one day you might need surgery, you're not alone. But there's a difference between the people who will be able to avoid surgery and those who won't. And that difference lies in small, everyday mistakes that seem harmless, but slowly destroy the joint. It's like a water leak. You don't see the damage on the first day, but 6 months later, the ceiling collapses. Now let's go straight to the 5 most common mistakes. The first mistake is ignoring the early signs. You feel a slight twinge when climbing stairs, morning stiffness that goes away after a few minutes, discomfort when you sit for too long, and you think, it's just fatigue. It'll pass tomorrow. Everyone my age feels this, but it doesn't pass. And while you ignore it, the problem keeps advancing behind the scenes. The joint is losing protection, and when the pain finally becomes impossible to ignore, the damage is already extensive. The second mistake is believing that complete rest will fix it. You feel pain and stop moving. You avoid walking. You sit more. You think you're giving your hip time to recover, but the opposite happens. When you stay still for too long, the joint stiffens. The joint gel that should be circulating there becomes stagnant. The muscles weaken, and when you finally try to move again, it hurts even more. The balance is delicate. Too much movement without protection causes damage. Too little movement also destroys. The third mistake is relying only on anti-inflammatory drugs. You take the medication, the pain decreases, you think it's solved. But anti-inflammatories only mask the symptom. They don't restore what's being lost inside the joint. They don't rebuild the protective layer. They don't nourish the cartilage. It's like putting duct tape on a leaking pipe and thinking you fixed the plumbing. And there's more. Continuous use of anti-inflammatories can harm your stomach, kidneys, and liver. You relieve the hip and damage something else. The fourth mistake is doing the wrong exercises, or doing them the wrong way. You read that exercise is good. You decide to walk. But you walk on hard surfaces with worn-out shoes, poor posture. Or you do squats without guidance, forcing the hip into an angle that causes damage. The right exercise strengthens and protects. The wrong exercise accelerates wear and tear. The intention is good, but the result is disastrous. The fifth mistake, and perhaps the most dangerous, is thinking that common pharmacy supplements solve everything. You buy glucosamine, chondroitin, collagen. You take them for months, and you feel no difference at all. Do you know why? Because these ingredients don't attack the root of the problem. They were designed for cartilage, but the real issue lies in the joint gel that protects the hip. It's like trying to fix a tire when the problem is in the engine. Now pay close attention, because this is where things get serious. Each of these mistakes on its own is already bad, but when you combine them, the destruction accelerates in a frightening way. The joint loses protection. Inflammation increases. Pain becomes constant. You lose mobility. You stop doing what you love. Your life shrinks. And one day the doctor says, "There's nothing else we can do. You'll need surgery." But was there really nothing that could be done? Or could it have been avoided? Let me ask you a question. If the problem were just natural wear and tear, why are there people in their 80s who have never felt hip pain? Why do some people who were always active suffer so much, while others who never exercised feel nothing at all? The answer lies in a recent discovery. Harvard researchers studied thousands of ancient skeletons. They expected to find destroyed hips, since those people walked long distances, squatted, and carried heavy loads all day long. But the hips were healthy. strong, functional. If wear from use were the main cause, they should have been ruined. But they weren't. The conclusion changed everything. Wear and tear is not the main cause. Something else is happening, and that something is the progressive loss of a protective layer inside the hip. Scientists call this the joint gel. Think about it. Inside the hip joint, there's a space filled with a thick protective gel. This joint gel acts as a lubricant, a shock absorber, and a source of nutrition at the same time. It keeps the bones separated, protects the cartilage, absorbs impact, feeds the cells. When you're young, this gel is dense, elastic, and healthy. But after the age of 30, you begin to lose a substance called hyaluronan, which scientists refer to as the guardian of the joints. This substance is what keeps the joint gel thick and functional. Each of its molecules can absorb up to 1,000 times its weight in water. Lose hyaluronan, and the gel dries out. It becomes thin, weak. And without this joint gel working properly, 3 bad things happen. The bones move closer together and begin to rub. The cartilage stops receiving nutrition and starts to die, and inflammation invades with no barrier at all. All 5 of the mistakes I mentioned earlier, they accelerate this loss even more. Ignoring the signs lets the problem advance. Staying still blocks the circulation of the gel. Anti-inflammatories don't replace anything. Wrong exercise causes more damage. And common supplements don't reach what truly matters. But here's the good news. If you stop making these mistakes and start acting at the root of the problem, there's still time to avoid surgery. There's an interesting story about this. In a remote village in the mountains of Japan called Yuzurihara, people in their 70s, 80s, and 90s work all day in the fields, squatting, carrying weight, and none of them complain of hip pain or need surgery. Scientists investigated and discovered that something in their dietary routine keeps the joint gel dense and functional. But what exactly protects their joints? And how could this be applied here? Today, there's a way to apply the same principle without changing countries. A natural approach that works on 3 fronts. It helps restore lost hyaluronan, thickening the joint gel again. It reduces the inflammation attacking the hip, and it strengthens the body to maintain this support over the long term. Studies show that when this is done correctly, the first signs of improvement appear within the first few weeks. And most importantly, the results continue to build month after month. But pay attention. This is not magic. It doesn't work overnight. The body needs time to rebuild what was lost over years. Those who quit early lose the chance to avoid surgery. What really makes a difference is rarely talked about openly. Below this video, I've left a link that takes you to the next step. There, you'll discover why a dietary habit used in Japan is helping thousands of people avoid hip surgery. How to naturally thicken your joint gel without relying on medications or scalpels. Click the link I left right below in the description of this video and see how this works in practice. Your hip didn't break down on its own. It was slowly destroyed by decisions that seemed harmless. And now you know what to do differently.